I thought we'd start off having a little bit of a look at the background of the dental situation in Australia, if I can work the technology. Oh, beauty. According to Stephanie from the ADA, of the 17,500 dental practitioners who see patients in the clinic in Australia today, 14,500 are dentists. So basically what we're saying here are the vast majority of dental workers in Australia are dentists. And these are figures which are supported by Dana Tusner from the Australian Research Centre of Population Oral Health here. Now, of those dentists, the vast majority work in the private sector. So much so that even when you start talking about public, people who are eligible for public care, they actually seek their care in the private sector. More than 61%, according to ARCPO figures from the latest national survey, actually visit the dentist in the private sector rather than the public sector. So to quote Jane Harford and John Spencer in the National Survey report, the place of last visit was dominated by private practice. And this suggests that the private dental sector needs to be involved in any improvement of access to oral health care in Australia. Probably needs to play a major role. Of those dentists in the private sector, over 95%, that's over 11,700, are in the Australian Dental Association. So this suggests that the ADA should have a voice at any table for changes to the workforce which are suggested. The Australian Research Centre of Population Oral Health has done a lot of work on its workforce projections, and its report concluded that these most likely supply and demand projections result in an estimated supply shortfall of 2.8 million dental visits in 2020. And they say that this equated to an undersupply of about 1,000 dental practitioners. Interestingly, though, that the projection model appeared least sensitive to changes in attrition rates and increases of allied dental practitioners. But at the same time, it was most sensitive to differing productivity assumptions and increases in dentist recruitment beyond their projection level recruitment levels. So this suggests that maybe we should be concentrating on getting dentists into areas of need. The ADA goes on and questions some of the workforce projection input assumptions. We find that if you conservatively allow for an increased number of successful candidates who enter from overseas via the Australian Dental Council examinations, if we increase the number of dental students with the new universities which have been set up, such as Charles Sturt and James Cook, and an increase in numbers in existing dental schools, if we assume that dentists will continue to provide the same number of dental visits as they do now and keep all the other assumptions in their projections the same, we find that there will be an oversupply of about 3,000 dental practitioners in 2020. So the ADA argues that rather than we're heading towards a massive undersupply of dentists, the ADA argues that there is a maldistribution of the workforce around Australia. That then implies that the solution to access to dental care concerns might be more complex than just simply ramping up numbers of dentists that you're training within dental schools. So I thought we'd have a little look at these areas of inequalities in access to dental care. Well, it'll come as no surprise for you that, as Martin said, that we have a population which is ageing, and those graphs basically show that in the projections. It also will probably come as no great surprise to you that the rate of tooth loss, due to the success of the profession in ensuring that people keep their teeth, and due to the introduction of water fluoridation, that we're going to have people with a lot more teeth. As Bart mentioned, this has meant that the high-risk group for caries has moved from children, which is when I first got out in the finished my dental degree back in the 70s. It was mainly children that we saw with dental caries. It's now moved from children to adults. We find that more people over the age of 65 have teeth. And I like to tell dental students here at the University of Adelaide that they've got a problem, that it's not my problem. That basically all the baby boomers have got teeth. They've all got amalgam sitting in there somewhere, or crowns and bridges. We all hit the nursing homes, and it'll be their problem. What are you going to do about it? At the moment, of course, you walk into a nursing home, as Sharon will tell us, and that you have lots of little plastic cups with dentures, with usually the lower denture which can't be worn anymore, and when the people close together, their chin basically touches their nose. So, but that's not going to happen with us baby boomers, and I tell them that it's not my problem because I'm going to be the one dribbling in the bed, and they're going to have to do something about it. And then I glare at them and say, "What are you going to do?" However, these changes that have occurred then with the ageing population and with keeping teeth have been reflected in changes to dental care, right? We've found that people who are aged 45 and older are much more likely now to access private general practice. As a matter of fact, quite a few practitioners I see this as the target market group, because basically these are the group that have the disposable income. Within the dental practice, we've found that with the greater retention of teeth, increased use of services amongst adults, that the mix of services amongst adults has changed as well. We now have much more diagnostic services, preventive services, and much more of the complicated procedures, such as endodontics, crown and bridge, implant procedures, orthodontics, and the like. There are often less complicated procedures such as restorative, denture work, and extraction services. So that's one area. Is the aged. The second area of need is that we need more dental care in rural locations. The more remote you go in Australia, the less the number of dentists. Dentists in rural locations are busier, work longer hours, see more patients, whilst people from rural areas have to wait longer to get dental care.